I just really want to thank our witnesses, not only just for being here today to answer all of these questions, but for 3 years of an unprecedented challenge, working every day to try and protect the American people. So thank you for that. I wanted to talk a little bit more about disinformation and the effect that it really had. Over 1 million Americans died from COVID. I'm just wondering if there's even any estimate of what if there had been the acceptance of the opportunity to be able to use the vaccines, if there's any estimate of how many lives we might have saved. Dr. Walensky, is there anything like that?
You know, I'm not familiar. I wouldn't be surprised if folks who at Yale who've done some of these estimates that you previously heard about in terms of the lives that saved, the millions of lives that have been saved, would be embarking on that, but I'm not familiar with that. I'd have to get back to you.
Well, let's just, can you talk a little bit more about what the consequences? Did anybody else want to answer that?
Yes, I mean,
Oh,
if
go
I
ahead.
may, it's pretty unusual for a person who's up to date on vaccination and had access to the powerful antiviral drugs that we have to die from COVID. It's a rare exception when that happens. So, in fact, there's a great study that just came out last week about doctors. We were losing hundreds of doctors until the vaccine came out. It has a beautiful graph in it that shows that once the vaccination, because doctors almost all got vaccinated right away and have stayed up to date, we now have a lower than expected mortality rate in doctors because of this intervention. So you can pretty much extrapolate that. Remember, the number to be relatively precise, it's hard to be completely precise, 80% lower chance of being dead. Now, I'm a cardiologist, so I'm used to thinking about life and death, and most people can pretty simply think about this. Something that reduces your risk of being dead by 80%. That's important, and you can then back extrapolate. We can't put exact numbers on it, but it's rare for someone to die from COVID if they're up to date on vaccination and have had access to the antivirals.
Well, thank you so much. 209,000 nursing home residents have died because of COVID. And I just wanted to talk to you about what we can do to address this particular population to make sure that we can keep them safer. I don't know, any Dr. Walensky or whoever.
Yeah, I very much appreciate your work and advocacy for this population, because it is, in fact, this population that in this moment is most vulnerable. We're seeing deaths more in elderly population right now, those who are not vaccinated. Right now, we have about 51% of our residents living in nursing homes who've received the bivalent vaccine, but in my mind, that is not enough, and our team is working really hard. We've engaged with our long-term care facility pharmacies to make sure that we get vaccine into those pharmacies. One of the challenges also was the multi-dose, so we're working with those pharmacies to get single-dose vials so that they can actually use those single-dose vials. We're also working within the states to have home health aides and EMTs go to those long-term care facilities where they may not have medical care on site, so that those people can actually visit them and provide vaccine. And then we've actually waived the data needing to come in to facilitate it even further. So we've had enormous amounts of efforts for exactly the reasons that you know. Thank you for that.
So I wonder, not just about COVID, but what has CDC learned about best practices to address infections, et cetera, that are in nursing homes? This is a real problem.
Right. Well, in fact, we have a whole unit that works on infection control prevention, and that has been specific to nursing homes. We have data that come in weekly from our 15,000 nursing homes through our National Health Survey Network. So a lot of work happening within the nursing homes because of this particularly vulnerable community, not just that we see in COVID-19, but as we saw with influenza, as we see with RSV, again, prone and vulnerable to numerous infections and other threats.
Thank you, and I see my time is almost up. I'll yield back. Thank you.